You're listening to the Pre-Hospital Care podcast on the Medics Academy Network.
Welcome back to the podcast. This is part 2 of the grief and indeed bereavement series that we're running with Liz Gleeson. In today's podcast, we're going to take a deeper look at the many faces of grief that pre-hospital professionals may encounter in the field. So they're often subtle, complex, and deeply embedded within human ways. So grief is commonly associated with death, but it also extends far beyond death, touching every kind of loss, really from separation and divorce to anticipatory grief, perinatal loss, and the unique pain of suicide bereavement. So Liz really is going to guide us through some of these lesser known aspects of grief. Liz is a psychotherapist, educator, and grief specialist. And what we're going to do is really talk about disenfranchised grief, anticipatory grief, parental bereavement, sibling loss, grief in older adults, but also the grief following perinatal loss as well. So we're also going to explore how non-death losses like divorce or indeed family estrangement can trigger profound grief responses that we may not recognise in patients or indeed patients' families during emergency care. Welcome to the podcast, Liz.
Thank you, Owen. I'm feeling a slight pressure about all of these subjects. You could talk for an hour just on disenfranchised grief or just on ambiguous loss or just on perinatal loss, but we'll do our best. And I suppose it's a conversation that's really, to touch on all of these subjects so that your listeners can understand there's a whole depth and breadth of knowledge out there to be found should they feel they need that. It's about finding out what we don't know that we don't know.
Yeah, I think I absolutely agree, Liz. And we spoke about this offline, just about sometimes unpacking these concepts, which are extremely deep, nuanced, and complex. And our podcast, in some much way, just touches on these concepts. And you're right, allows individuals to almost spark their curiosity, really, to go deeper. And what we'll do in the show notes is put links to your podcast, but also to your website, because I think it allows individuals, as we spoke in the last podcast, really to look at level 1, 2, 3, and 4. And some of these central concepts and adjunctive concepts, which really get unpacked in the training over time, and a podcast we can only really touch on these. So it is going to be a wide-ranging skim over these topics, but we'll skim them nonetheless, just to really spark, hopefully, some underlying interest in grief. I guess my place to start, Liz, really would be around disenfranchised and anticipatory grief. Could I get you to, I guess in a way, just unpack what disenfranchised grief means and how it might show up in emergency care?
Yeah, so disenfranchised grief is a term that was coined by Dr. Kenneth Doka for losses that aren't really acknowledged by society. Therefore, the grief becomes disenfranchised or unacknowledged, unsupported. We would have seen this in times gone by, certainly with LGBT couples, where one partner would die and the surviving partner would not get the acknowledgement of their loss or the validation of their emotions, and the grief would have become disenfranchised. Or, for example, what if your ex-husband dies? Do you get any support then? You've been divorced 10 years, he doesn't matter anymore, but you had 30 years prior to that and 4 children, so the grief of an ex-partner can often be disenfranchised. Or in the case such as miscarriage, where maybe nobody knows that the woman was pregnant, and therefore the loss is unacknowledged and the grief again is disenfranchised. So there's many losses that are not apparent or not recognized by society, and therefore the grief can become disenfranchised. Or even the case of sibling loss, the amount of siblings who desperately grieve their deceased sibling, yet people say, "How's your mum? How's your dad doing now?" As if the sibling's grief didn't matter or doesn't matter. So grief can be disenfranchised in many ways. Or also the way that someone has died. They died from a drug overdose, or they died by suicide. I don't know what to say about that. They're really difficult topics. So I'm going to say nothing at all. And in doing so, I am disenfranchising the grief again.
So let's just flip it actually, Liz, and look at anticipatory grief. So palliative and or end of life care. So there is a loss, a gradual loss, and the grief might not have yet fully been embodied or indeed come to fruition because it's palliative and the patient is still alive. Could I get you to really just unpack really how we support sensitively individuals experiencing anticipatory grief?
Yeah. I mean, I think grieving starts the moment we know that our life is going to change irrevocably because our loved one has a terminal illness or a life-altering condition, chronic illness. Um, Life as we know it is going to be different, and therefore there's a change, and therefore there's grief, you know. We also, and a lot of people I think have often feel really ashamed of this or feel guilty for grieving while somebody's still alive. But essentially they are, it's exactly in the term, anticipating a death, anticipating what they're going to lose. Um, and feeling the pain of that and imagining what that might be like. But also, it's not, I don't think it's ever really just anticipatory grief. It's also ongoing losses. Like when someone has a terminal illness, let's say someone is diagnosed with stage 4 cancer, which is terminal and can't be treated. Not only am I grieving their potential death or their probable death in the future, but I'm also grieving the life I used to have where my biggest problem was who's walking the dog next Monday. You know, I might be grieving the loss of assumptions about the future that we're going to grow old to die. We're going to grow old together. I might be grieving the retirement that I thought we were going to have, and now it doesn't look like that's going to happen. I might be grieving the loss of my sex life because now that my partner is terminally ill, that might be off the table. I'm grieving the stable, secure life that I knew. So it's not just anticipating their death, there's a lot of loss in the anticipation of someone's death.
Yeah, it's so multifaceted actually, and indeed quite complex. Let's just pivot and look at grief within the elderly or indeed geriatric population, Liz, and how it might manifest in older people. Could I get you to really just unpack and maybe we could explore together just the unique challenge of just geriatric grieving and indeed how it might look for older people and indeed acknowledge how we acknowledge that and maybe get alongside elderly to really support them better.
Mm. And I'm having a visceral response to that term geriatric, right? It almost dehumanizes people who are older, you know? Um, Older people and grief. Yeah, there's so much myths around that. We think because people reach a certain age, they've experienced a lot of grief in their life, therefore they're able for this, or they were expecting it because, right, they're 90 or they're 80. It's not the case at all. It's not the case at all. Losing somebody you love at any age, particularly a spouse who you love, it's like an amputation, you know? It's like an amputation, and you don't heal from that. You don't get over that. You have to learn to live with that. But it can be incredibly difficult for both genders, especially if the person who is deceased was the one who paid the bills or took care of things, male or female. But it is a myth to think that older people do death better than younger people. And I suppose when you're older as well, there's more social factors that can impact how you're grieving as well. You probably have a smaller social circle. Maybe mobility issues mean you're not able to go out and engage with your community. Therefore, there's less people acknowledging the loss, less people validating the emotions, less people providing support. And we're not great in our society with older people in general, never mind at times of bereavement. And many people that I've supported, you know, of an older age, just talk about the immense loneliness. You know, even if they do go out or make social efforts, if you like, coming back to the empty house at night or the weekends tend to be really difficult Like people are happy to meet up for lunch during the week, but their weekend is for their families. And so there's a lot of older people who are enduring weekends, getting through them. But I think loneliness is by far the biggest issue for older people, as well as our assumptions that they can handle grief better.
And I suppose one aspect that might complicate that as well is cognitive decline and just pathology, which just is both either physical or mental, and the dementias and or the Alzheimer's just that complicates the memory and indeed the process of grief. Would you have anything to sort of say to that? Have you indeed experienced that, or indeed come up against that challenge really?
Yeah, I certainly have in my own personal life with my father at the end of his life. And my mother died 20 years ago. It was just her 20-year anniversary the other day. But towards the end of my father's life, which was 4 years ago now, um, he used to ask for her all the time. So he had, cognitive decline, a touch of dementia, a touch of Alzheimer's, I don't know. But he would say, "Where's Teresa? Where's Teresa?" And initially I'd sit down, Jen, and go, "Dad, she died," But very quickly, I just thought, I'm just going to say she's resting, because in a way she is resting forever. But it was just, a gentle way of just saying she's resting. And maybe, one day he was like, "Is Teresa having a nap?" I said, "Yeah, she's probably having a long nap." So just to go along with where he was at in that moment seemed to me to be the kindest way of dealing with that.
Yeah, absolutely, and coming alongside them in that, absolutely. Just looking at really parental bereavements and perinatal loss. Let's just start with parental bereavement. It is in a way, I guess, one of the most complex forms of grief. I just, and I unfortunately, and I'm sure many other sport providers have had to deal with parental bereavement in extremely difficult, challenging circumstances, horrendous circumstances involving suicide, death by suicide. Could I get you to speak to really how we, I guess, in a way, deal with these cases as sensitively as possible in such a visceral and tragic moment?
More humanity, and even more humanity. I think it can be shocking for people attending the scene. And again, like I said before, how we show up really matters. Um, I spoke with Fiona Toomey, who's the founder of Hug, a suicide bereavement charity here in Ireland. And Fiona's daughter Millie was very young when she died by suicide. She was 11. But Fiona talks about the absence, the tumbleweed in the house, like how even for the police liaison officer, it was too much. That people were not able to bear this immense loss or get their heads around it. And so the absence of people, in supportive roles was visceral. Like they were so alone. I remember Fiona saying, "I thought the cavalry would come if something like this happened." But there we were left sitting alone, with our heads spinning, and people were afraid to approach them because of the super sensitive nature, of their child's death. So, back to, can you show up? Can you be of service? Can you be that person who's not scared to knock on that door and sit down with that mother? Can you be the one who could bear this pain alongside them? Even if you don't know what to say, even if you don't know what to do, like any other situation, a hand on the back, a cup of tea, not running and or being absent, which will all exacerbate the process for people, but truly showing up and maybe following up also. Just again, a profound humanity. But I think really the difference here is there's a tangible fear among attending people that it's so sensitive, they're going to get it wrong, do more harm, or they can't bear it themselves. So maybe we need to run through that in our heads about how am I going to deal with these situations when they occur, not if they occur, when they occur.
Yeah, indeed, indeed. And they are never easy. And there's never, to your earlier point on the other podcast, is there's never one formula. There's never one answer. It's actually deeply human. And also through the longevity of time, it's absolutely, as you said, time to stop the stop clock and not worry about the next job or indeed the next incident. It's what this patient or indeed what this family member needs right now. And an enduring sense of that. Let's look at perinatal loss. This is a really heavy conversation, but to your point, needs to happen because also to your point, these circumstances, if you're in pre-hospital care for long enough, will happen, and you will have to engage with these incidents. And also to your point, it's better and it's prudent to have education to engage ahead of time and think about how you will react and enact in this situation rather than be reactive. So let's just talk about perinatal loss and, such as stillbirth or miscarriage, and dealing in compassion and with compassion, navigating these intense emotions from parents in real time. Could I get you just to unpack your thoughts around that?
Yeah, and just also to say there's also termination for medical reasons as well, and abortion and sudden infant death shortly after the birth. So there's many reasons why a baby might not make it to term or might die around the time of birth. I'm not an expert in this area. There is an in-depth training in this on the Shapes of Grief program with a bereavement midwife, Brenda Casey. Um, but perinatal loss is another one of those losses that's, the grief is often disenfranchised. It's we don't want to go there. We don't want to talk about it. We're afraid of making it worse. Like, as Brenda says, it's the ultimate paradox, death before birth. And it's incredibly sad. It's a shattering of all the assumptions we have about the future and our future as a parent or our future as that child's parent and all the dreams we concoct and, the hopes we have for them. It's again very visceral, particularly, people who are pregnant and going through all those physical implications of losing a baby, losing a pregnancy, losing a baby in and around the time of birth. And again, we need to fact find. We can't make assumptions. For some people, they're able to deal with pregnancy loss quite pragmatically. And for others, it's absolutely devastating because they've been 8 years trying, you know. So every situation is different. And again, compassion, kindness. We never say things like, you'll have more. Do you have more? Well, that's okay then. We do tend to say, how many weeks were you? As if the number is going to determine how much compassion we'll give them. If it was 7 weeks, we'll give them a bit of compassion. If it was 23 weeks, we'll give them a bit more for that. These are questions that shouldn't be asked. Again, it's very physical. It's a very physical experience. So a physical supportive response is essential, and absolutely grief training. Understand what this might mean, understand how to use empathy rather than sympathy. Never minimize the loss by saying, at least you can get pregnant, or, you've 2 other children that need you. Any way we sort of try and silver line a situation, we're actually minimizing the loss and further isolating the bereaved person.
So let's look at death by suicide. Again, very challenging, but again, also something that pre-hospital providers, paramedics, EMTs, otherwise, will have to deal with. Actually, the longer they're in the job, these incidents will present themselves. Could I get you to really, I guess, in a way, just explore just the immediate and long-term grief responses unique to suicide loss, Liz, and indeed, really how responders might approach these situations without reinforcing stigma or indeed shame?
Yeah, and again, I'm not as a specialist in bereavement by suicide, but what I will say is, for most people, it's absolutely shocking. It's earth-shattering, and it's a physical experience. Like the immediate aftermath is often very, very physical, which can produce PTSD, as you know, and flashbacks. Um, Acknowledgement again of the loss, validation of the emotions, and just being really aware of the physicality of grief, the physicality of trauma. What's happening in the nervous system, what's happening in somebody's body, what do they need right now, to help them stand, to help them, just process what's happened, although that will take a long time. But again, quite a physical response, I would say, is very important. And again, training around what's happening in somebody's body. And, words are unlikely to make a huge difference at that point. But certain words like, this is not your fault. This is devastating. There is support. I know it doesn't feel like this now, but you will survive this. You will be okay. So again, like I said before, offering them just a little sign of hope. And then also we have to be aware of that people who are bereaved of suicide are at risk of suicide. So we need to make sure that they're safe, and that there's supports around, and that there's a safety net for them in place.
No, absolutely, and that community aspect is vital actually for them to process and indeed just to presence, just to be around. Just looking at sibling loss, Liz, this is in a way, like we said before, it's a wide-ranging conversation, and we are really just only touching on these concepts. There's so much more to go out within this. But just how does sibling loss differ from other types of bereavement, Liz, and especially in younger individuals? And indeed, what signs might hospital staff look for in siblings present at the scene, just to really, in a way, just to come alongside and just really support them?
Yeah, and there's this funny concept of people who often say, look after your mum, to a 7-year-old. Sibling loss is profound. You are probably losing someone who's been alongside you your entire life. They're part of your foundation. You've a shared childhood together. To lose a sibling is profound, and somehow it's often disenfranchised. As I mentioned before, we'll go, how's your mom? How's your dad? As if your loss doesn't matter. But sibling loss can profoundly shake somebody to their core. And I think it's to re-enfranchise the loss, so rather than disenfranchising it, it's good, the same thing, give them the same attention as the spouse or the parent is getting. I'm so sorry this has happened, this is so scary. You're going to feel all sorts of really difficult emotions. I mean, I'm assuming we're talking to a child here. But absolutely, what our children, siblings are often called the hidden mourners or the forgotten mourners, And then, of course, like supporting a parent is good to be able, so they can support their children. But I think just acknowledging to the child, because sometimes we don't do that because we're, again, afraid of saying the wrong thing or making things worse. But acknowledging with the child the profundity of what's just happened is really essential. And children grieve differently. They do what's called puddle grieving. They're in it, they're out of it. They're in it, they're out of it. And again, we can see the child playing with their friends. I was at a funeral recently, and I could see a sibling of a deceased child wanting just to be with their friends and not go to the burial. That's typical. That's typical. It doesn't mean they're not grieving. It means they're just in and out of it, So it's important not to misread that. Or we go, well, they were having such a good summer camp. I didn't want to distract them by asking them who they were. And suddenly, in our attempt to protect that young sibling, we're disenfranchising their grief over and over and over again.
So just looking at just, I guess in a way, the final concept, Liz, really is this is non-death grief or indeed non-death losses. Um, could I really just get you to speak to and unpack really how grief from a non-death loss, like separation or divorce, impact individuals in crisis, and indeed how it might be misinterpreted or indeed overlooked, because I think, like you said before, sometimes we minimize the impact of a non-death loss, like a divorce. Could I get you to sort of just really, I guess, in a way, unpack that?
Yeah, sure. Non-finite losses, like there's so many losses that don't have a funeral. Like you said, separation, divorce. Um, there's the psychological loss of a parent when they develop dementia or Alzheimer's. They're physically present but psychologically absent, or vice versa also. There's the people who went off to war and never came back, presumed dead, but also they mightn't be. Or there's the people who come back from war, but with the trauma they've been through and the PTSD, they're not the person they were when they left. There's my brother who's got schizophrenia, for example, who isn't the brother I used to know. He's a different version now. There's my child who's become a drug addict. And I don't know how long they have. I'm constantly worried about them. And I haven't seen the beautiful young soul I know them to be for years. There's often estrangement with friendships, with family. All of these are ambiguous losses, which is a term coined by Dr. Pauline Boss. We look at these also in my training program. But what happens when a loss is ambiguous? It's often not recognized by society, right? So if the loss isn't recognized by society, it's very likely that the grief is going to be disenfranchised. Um, I'm divorced myself, and I can tell you, nobody came with lasagna when that happened. Nobody sent a card. There's a presumption that if we choose something, that it's fine, it's easy. But it is such a huge adjustment, such a profound loss. It's the family loses its shape forever. And it's not just sadness because you miss someone. Most of us get divorced because we're not going to miss them, right? But it's such a profound sadness that it didn't work out, or or the changes that are going to happen for our children, the financial difficulties, the different social status. You lose so much social status when you're not in a heterosexual married couple anymore. And that's something that very few people can really fully understand unless they're in that other position. So there's a ton of ambiguous losses and a ton of disenfranchised grief. Um, but if we go back to the Irish Hospice Foundation Adult Bereavement Care Pyramid, and if the needs of everyone who's experienced a loss and is grieving are acknowledgement, validation, psychoeducation, kindness, compassion, support, it's fair to say that if the loss is ambiguous and not recognized, but people are still grieving, right? Because it's a profound change or profound stress in their lives, or that they're grieving something that didn't happen as well as something that might have. It's fair to say that they're not getting the support that we know people need at that level, which can lead to ongoing problems. It can take longer to accept your new reality and feel the pain of your loss when it's not being acknowledged or validated. Like I remember the day I got divorced, which was actually, I think, 6 years after we'd separated. And I was very much, this is just performatory. We have to go to the courts and da 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 da. And I remember myself and my ex-husband hugging each other at the end of the courtroom. Oh, it was the saddest thing, And they'd read out our kids' names. And he was there with his solicitor. I think I was on my own. But I remember driving home from what I thought was just a pragmatic thing, and just the grief I felt of just the whole situation. Did I want to be back with him? No. Was it profoundly sad that this thing we had created, somehow we broke, And it was incredibly sad. Did anyone acknowledge it? No. Now, that was probably my own fault. I was probably the primary person disenfranchising my own grief in that case. And a lot of us do that. It's an important point. But I wish I had brought someone or even two friends. I wish I'd arranged to go for lunch with someone afterwards. I wish I'd told more people so that I could have got a little bit more support. So there was a good learning curve for me. Um, but it's really important that we know that grief isn't just after a funeral. It's throughout our lives and it needs support. And a hand on the shoulder can make a big difference. And when we talk about disenfranchising grief, I think, as I say, we are our own worst enemies sometimes.
No, listen, not only agree with that, but I would say that it's equally as important. And you made this fantastic point just there about disenfranchising your own grief. And one of the tensions I think within pre-hospital care is the affordance of care to other people, Liz. And I certainly went through this on multiple levels. And again, non-death loss or grief is if you don't deal or indeed reach out for help to someone, and it might be the breakup of a relationship, it might be the loss of a significant other in your life. It's very hard to actually embody it and actually be a care provider when you yourself feel broken. And I remember turning up to work a few times, more than just a few times, just thinking, I can't do this actually. And you get on and you do it, but actually just embodying that self-care, reaching out, getting counseling, or just community, and just going for a drink or dinner with somebody to try and piece your own grief journey, engage with your grief and piece your life back together, because it's so hard to be a care provider, paramedic, a nurse, a doctor, a physio, whatever caring profession, when you yourself feel broken. And I think that tension still runs through the current workforce, and actually that disenfranchising your own grief, it's hard to extend care when you don't feel yourself cared for. And to your own point, I actually think that's such a super point you made there, Liz, which is don't underestimate some of these mundane moments, which actually can be extremely profound, extremely emotive, and journey with other people. I think one of the biggest revelations I had is the how vulnerable I am. I think, when you're in your 20s and 30s, you think you're bulletproof, you just deal with anything. It's only really through the adage of time if you understand you're not bulletproof, and actually you carry things through, and either consciously or subconsciously, and probably more dangerously subconsciously. So actually it's taking time out, and it's actually dealing and reaching out for help through community, because that's only then can you be the best healthcare practitioner for other people, when you're dealing with your own grief journey in a different guise, or it will come out in various ways. It will come out, as it did with me sometimes at work. And that's just the last place you actually, to your point, need to be embodying your own grief, is actually when it's in someone else's emergency. So it's really important you do, like you said, the self-work. Just as we finish off, Liz, just a final really question to this last episode would really be around just how we increase the valence of awareness, how we increase insight into ourselves. And if you could just speak to really how we, just gain access, because I think this really is a central point around being the best version of ourselves at work, but also understanding the fun, like you said, the subtle grief, the hidden grief, the non-death grief. There's so much of it around us in the patient population. But could I get you to really just speak to just the anything that we can do as healthcare practitioners to really bring our best selves to work?
I think always beginner's mind. You know, I'm at this for 10, 15 years now of just specializing in loss and grief. There is so much I have to learn still. There's so much, and our understanding of things changes with time as well. Um, And I think bringing that beginner's mind to work is essential. This is a new person, a new life, a new relationship, a new situation. How can I show up as well for this person as I did on my first day of work, Um, and I think it's easy, like in our lines of work, to take things for granted, because we're at it so long. But remember, this might be the first time that this person has lost somebody that they love dearly or is going through something really difficult. If life isn't about giving each other a hand up, I don't know what it's about. Rocking up with compassion and care and being of service to other people. That makes me sound like Mother Teresa, and believe me, I'm not. But I think, there is a response we have in our bodies, which is a caregiver response. So some people, and I wish I knew more about this actually, when we have when something triggers a stress response, we've all heard of fight, flight, or freeze. Well, fight, flight, fawn, or freeze. But there's also another response, which is a caregiver response, where we're moved to alleviate somebody's suffering. So this is the response a firefighter might have when they plunge into a house on flames, or the person that runs towards the road traffic accident rather than stands freezing at the side. I know my response is a caregiver response. I generally spring into action if I feel that there's something I can do. That's the key. We tend to freeze if we don't know what to do or feel that we've nothing to offer. But if we feel we can make a difference, we have this impulse to alleviate. And that's really important to know. Like, we are hardwired, many of us, to alleviate suffering and to support others. And we need to remember that that's our job, literally. That is literally our job, to move towards the suffering, to move towards the pain, and be there as a scaffolding for somebody whose foundation has just crumbled beneath them.
Listen, thank you, Liz. It's amazing just to walk through this with you, actually, and just get these seeds of wisdom. What we'll do in the show notes is we'll put links to your website and indeed your podcast. I think this is a real signposting exercise because there is such depth to this topic, and the training and competence you're speaking about is absolutely necessary, I think, for the frontline workforce. But there's also levels that people can go away and have a look at, and some fantastic resources really on your website. So we'll put that in the show notes. But listen, thank you so much.
You're so welcome. And it's shapesofgrief.com for anybody who wants to head over there. We'd love to see you and support you. And thanks, Owen. Thanks so much for your time and for covering this really important topic.
You're listening to the Pre-Hospital Care podcast on the Medics Academy Network.